Hello. Are you here for a physical therapy appointment? Good. Well, it's nice to meet you. Is this your first time in the office? Good. Well, welcome. And remind me what your name is. Okay. And have you been to physical therapy before? Okay. So as a physical therapist, I'll be helping you recover from your surgery. And remind me what it was for again. That's right. Okay. How have you been feeling? Okay, good. Let me just ask you a few more questions, and then we're going to do a series of exercises to just see how you're feeling and doing overall, okay? So let's see, remind me when your surgery was. Okay. So not too long ago. And who was your referring doctor? Okay, yeah, he's really good. And did he also do the surgery? Yeah. Okay. So as of right now, what would you say your pain level is at? Okay, so on a scale from 1 to 10. Okay. And when does your pain seem to be the worst? So is it when you wake up in the morning, during the day, before bed? Okay. Yeah, that's pretty common. And let's see. What medications are you currently taking for the pain? Okay, and this is your first appointment since surgery, we know that. And what is your occupation? What's your typical day like? Okay. So then your shoulder is involved throughout the day. Okay, so this is great, and I think we can get started. So like I said, we will be running through a series of exercises and stretches, just so I can see not only your current pain level, but just how you're currently healing as well. So let me know if we do anything that causes pain. It might hurt a little bit, but we don't want it to hurt too bad, okay? So that's the only job you have. And these exercises are very simple, so you shouldn't have any difficulty. But again, we just want to be careful with your shoulder, of course. So let me just first listen to your heartbeat. I just want to make sure everything sounds okay. So if you don't mind, please just lift up your shirt for me. Okay. And deep breaths when I say so. Okay. Deep breath. Very good. Deep breath. Good. Deep breath. And then one more. Deep breath. Okay. Very good. Everything sounds normal. And when was your last check-in with the doctor who did your surgery? Okay, perfect timing then for this visit. So I'm going to need you to keep your shirt off for me. I do want to just see your muscles move when we do these stretches. So I'm just going to put on some gloves. Okay, gloves are on. So the first thing I'm going to have you do is just stay still, and I'm going to just feel your shoulder and neck area, okay? So yeah, just stay still. Does that hurt at all? What about right here? What if I press a little bit harder? Okay. And then let me just feel that shoulder very lightly. What is the pain level? Okay. Okay, good. So the next thing I'm going to have you do is just tilt your head from side to side for me, and I'm going to have you just hold it, okay? So just follow what I do. So first, let's tilt your head this way, and I'm going to count to 5. 1, 2, 3, 4, 5. Okay. Now let's tilt the other way. 1, 2, 3, 4, 5. Okay. So any pain? Okay. Now you're going to tilt down for me. So just tilt your head down, and we're going to count to 5. 1, 2, 3, 4, 5. Good. Now tilt it up. Okay. 1, 2, 3, 4, 5. Okay. So let's just see. Everything's looking good. Okay. Next, I'm going to have you lift your arm to the sky. So let's start with your left arm, please. And I'm just going to hold it up. Count to 5 again, so good job. Hold it. 1, 2, 3, 4, 5. Okay, you can put it down. And now your left arm. Okay. 1, 2, 3, 4, 5. Okay. Very good. So now for this one, I'd like you to have your arms just bent to the side like this. Okay? And I'm just going to put a little bit of pressure, and I need you to tell me the pain level for that. Okay? Okay, so right there. Very good. So, now when I push, do you feel any pain? No? Alright, let's try this one. Okay, what about there when I push? Any pain? Okay. Okay, so perfect. The left side. So the next exercise is just putting your arm across your chest. So first, let's just do your right arm. So if you could just give it to me, please. And I'm going to cross it over. Okay. And I'm just going to hold it here for a moment. And do these muscles hurt when I feel them? Okay. Okay, you can put that one down. And now let's do your right arm. So just cross it over. And same thing. Now obviously I'm going to be a little more gentle. So does this one hurt a little more? Yeah. Okay. So that's nothing out of the norm. Obviously after a surgery, you should still have a little bit of pain there, so it's not as bad as other patients though, so you are healing quickly. Alright, and then next is your internal rotation. So I need you to take your arm and then hold it in the back, just like this, okay? So let's start with your right one first, and I can help you. So yeah, just put your arm like that, and I'll just hold it right there for you. Okay. How does that feel? Next, I'm just going to do a few strength exercises. So for the first one, can you just put your arms out straight for me? Very good. And I'm just going to count to 5 and put some pressure. And you're just going to want to resist that pressure. And then obviously if it hurts, let me know and I'll stop. Okay, so arms out. Okay, and here we go. 1, 2, 3, 4, 5. Very good. And how was that shoulder? A little sore. Okay. As expected, so that's okay. And now for the next one, I'm just going to push against your hands. So just put them out in front of you. Okay, good. So here we go. 1, 2, 3, 4, 5. Okay. How was that? Still a little bit. Okay, so I just need you to go like this, put your arm on the back, and it actually feels really good. Just be gentle on your shoulder that had the surgery. We're just going to hold it like that for a few moments, okay? So why don't you start with your left arm. I'm just going to feel your muscles when you do it. Very good. Okay, and let's do the other arm. And again, I'm just going to feel the muscles. Okay. Good. Well, your strength is coming along. Your right side is normal, and then the left needs a little bit of work, but that's why I'm going to be helping you over the coming months. And what I'm about to show you right now will be very helpful. So the next thing I want to do is just show you a few at-home exercises that I'd like you to do before the next appointment. So it's very important that you actually do these, so put a reminder in your phone. This is to just ensure that your shoulder is getting the attention that it needs every single day to help the healing process. Okay. So the first one is actually just pulling your shoulder blades together. And I want you to do this about 10 times throughout the day. So do a few in the morning, afternoon, and night. whenever you have time. So you're literally just going to push back your shoulder blades to a comfortable position and just hold it for a few seconds. So why don't you just try for me right now? Okay? Yep, and then just hold it right there. Very good. Make sure you're in proper position. Yes, very good. Okay, so a pretty easy one. And then the next one is another simple one. Just want you to do shoulder shrugs. So I want you to do about 15 to 20 of them throughout the day. So all that is lifting your shoulders up and down, okay? So can you try that for me? Okay. Very good. Up and down. Up and down. Perfect. And then the last exercise actually involves a weight. So I would not recommend you using a 5-pound weight, but I just wanted to demonstrate it. Do you have maybe a 1 or 3-pound weight at home? Okay, so that's what I would recommend. And then what you're going to do is put your arm down at the side and then just lift directly up like this. Okay? So I only want you to do what's comfortable. So don't put too much strain on that shoulder, and just only use the 1-pound weight if that's what feels the best. So I think that is all I have for you. Let me just check my paperwork. Now, how are you feeling right now after those exercises? Okay, so just a little sore. I would recommend still taking the medicines that you're taking. And all in all, you are making good progress thus far, so I'm very impressed considering this is your first appointment. So I'd like to see you back in 2 weeks. And my goal is to have you obviously progressively get better and used to the exercises so that you can do these by yourself. Maybe after a month and a half, I'd like for you to not have to come back in so that you can just do these on your own and check in with your doctor. Just going to write a note here, and you can take this to the front desk. They'll schedule you for the next appointment. Will you be available in 2 weeks? Okay, good. Perfect. So here's the paper. And like I said, just take this with you. When you leave, here you go. And lastly, I just want to remind you to take your time with those exercises and stretches, and make sure you don't force yourself to do anything that might be hurting your shoulder. So when you're at work, if you need to take a break, take a break. If you're at home and you need to sit down and rest, sit down and rest. Make sure you continue just taking good care of it. And if you have any flare-ups, continue taking the medicine like I said. And I also find that putting a cold compress on it can sometimes make the muscle feel better. So that's what I would recommend. So do you have any questions for me at this time? Good. Well, you are a wonderful patient today, and I truly hope you feel better soon. And I promise that with doing those exercises and taking care of yourself, you will heal very quickly. Okay? Well, take care, and please contact me if you need anything at all.